When you're looking for Whirlpool innovation and quality, who has the answers, the selection, the price? Ventura TV Appliance. With billions in nationwide appliance buying power, more than Home Depot and Best Buy combined, will help you save. Our low prices on Energy Star qualified Whirlpool appliances save you energy and money and pay no interest on select models when paid in full within 12 months. Ventura TV Appliance, serving you since 1951.
Hi, I'm John Malice, and welcome to this live edition of Connect with Me on the showroom floor at Ventura TV on Comcast Channel 187 and 43.6 on this Tuesday morning. Glad to have you along today. We're going to be talking about Obamacare, better known as, or I think it's widely known as, the Affordable Care Act. We're going to be talking about that, and your phone calls are encouraged. I know it's a hot button issue, especially right now. This week, in the last couple of days, I know they're holding hearings on Capitol Hill about the website. So, 436 MeTV option 11. Don't wade through the message. Remember, turn down the sound on your television set if you call in. Back in just a moment. Back here live on the showroom floor, of course, at Ventura TV, and we're glad to have you along. 436 MeTV option 11, and do not wade through the message, and please turn down the sound on your television set. And it's a special day here. I know it's a hot button issue, especially the last few days, talking about Obamacare. I know it's the Affordable Care Act, but everybody calls it Obamacare. And I'll tell you what, right now, I think I would do just about anything, not anything, but almost close to it, to be a fly on the wall inside the White House, perhaps the Oval Office, just to hear some of those conversations going on about health care right now, the website, the latest news. There are hearings going on Capitol Hill, and you may have read the paper this morning about the Affordable Care Act. They're now giving people a 6-week extension to sign up. They'll have until the end of March. Those are for those individuals who have the individual plan, the health plans. You have to be signed up by the end of March. I believe it's March the 31st. We have an expert here in the House to talk about that in just a few minutes. Also, you may have heard yesterday or the day before that the White House, Jay Carney, the White House's spokesman, now admits that back in 2009, when they first all started putting this together, the White House knew that there were going to be several individual policies canceled. Not only several, but millions upon millions. You might remember in 2009, President Obama stood before the American public and said, if you want to keep your health insurance, the current health insurance that you have, you can. Now come to find out that up to 80% of 14 million Americans who have individual coverage will receive cancellation notices in the mail because their coverage no longer has been grandfathered into Obamacare, so to speak. So now they have to requalify for their individual health care, and they're getting sticker shock. And in some cases, their premiums per month are doubling. To top it all off, this past weekend, Saturday Night Live, one of my favorite programs, did an incredible Obamacare spoof. Here it is.
Hello there. I'm Kathleen Sebelius, Secretary of Health under President Obama. Now, a lot of folks have been talking about our new healthcare enrollment website, how it's been crashing and freezing and shutting down and stalling and not working and breaking and sucking. Well, tonight, I have a number of friendly tips to help you deal with those technical problems. For example, have you tried restarting your computer? Sometimes it helps to turn the computer off and then turn it back on. We don't know why, it just does. If our website still isn't loading properly, we're probably just overloaded with traffic. Millions of Americans are visiting healthcare.gov, which is great news. Unfortunately, the site was only designed to handle 6 users at a time. So if you're in a rush, consider using our low-res website with simpler fonts and graphics. Nice.
The White House had to be, oh my goodness, they were probably jumping out of the windows at the White House when they saw that on Saturday night. Live in our studio right now, he's not going to jump out the window, is Vic Gunderson. He is a healthcare expert on Obamacare, on the Affordable Care Act. He'll be here to answer all of your questions. 436-MeTV, option 11. Of course, Vic works at the Mike Dermanuel Insurance Company, a very well-respected company here in the Central Valley for many, many, many years. Vic knows all about this right now. He's gone to classes. He's done testing. He answers all of the expert questions that you want to know. 436-MeTV, option 11. Turn down the sound on your TV set. Back here with our special guest, Vic Gunderson, in just a moment.
Now, why don't you tell us the whole story right from the beginning? All right, from the beginning. This is the city, Los Angeles, California. My name's Friday. I carry a badge. Police officers.
You any idea who the other man was?
My partner's Bill Gannon.
Program?
We got just one big question.
Yeah.
When?
Now on MeTV Fresno, Xfinity 187.
I said before, it's a hot button issue. We want to get right to it. Be patient. If you can't get in right away, just keep calling back. 436-MeTV, option 11. Turn down the sound on your TV set. Vic Gunderson is here. You're an expert on this Affordable Care Act, and you work for the Dermanuel Insurance Company, a very well-respected company. Been around for a long time. How many years now, Vic?
Around 35 years, 37 years actually in the insurance business. So.
Amazing. We had a call coming in.
Sure.
So in the monologue, I said, let's go over this one by one, item by item, and that is the first item. They extended the deadline until the end of March. Exactly. Yes. Put that into words and what that means.
Okay. Well, the way the original rule was set up for the first year going in, we were going to have open enrollment from October 1st through the end of March 31st. But because of the individual mandate, you had to have insurance and you could not have a gap longer than 90 days. So in essence, you had to enroll by the middle of February because the middle of the month, you couldn't be enrolled and on a plan until the first of the following month. So what they did is they extended it, so now you can enroll as late as March 31st, and yet it won't be effective till May 1st.
And not get penalized.
And not get penalized.
All right,
That's
take
correct.
a call here. Good morning. You're on with Vic Gunderson. What's your question, quickly?
Hi. How does this work for somebody like me that, without saying where I work, I get my insurance through the union. Now, the union requires me to have insurance through them. Can I just opt out now and, save myself some money because I'm paying, pretty good clips for insurance to the union, over $500 a month.
Yeah.
And I've seen through Obamacare that I could maybe get it cheaper.
No, not necessarily. You the $500 also probably covers several other benefits. But if your plan, and I know I have not yet seen a union plan that didn't meet the minimum essential benefits, and if that's the case, if you opted out, you can opt out, but if you opt out, there's no government subsidies in the exchange for those that have a health plan through their employer. So I doubt very seriously you'd have a comparable plan, and it would be affordable for you and your family.
Okay, thank you.
All right, so this doesn't affect people who are covered under their current employment. This is for people who have individual health care plans, is that right?
The ones that are being canceled right now don't meet the required plan designs. The government has basically said, hey, here's the minimum plan designs that you have to have.
The minimum requirements, right?
Yes, and you can have richer plans. That's the bronze plan is your minimum. They're metal plans.
Right,
so you got platinum to bronze.
Is that why I said in the monologue? Because up to 80% of 14 million Americans who are covered individually with individual plans, they're getting cancellation notices because it doesn't meet that.
Well, it may meet it, but in some cases, but the carriers now have to get rid of all those plans.
Why?
Unless they were grandfathered, because they have to be written the way the government says they have to be written now on the individual side.
So if there's a sentence that's amiss, they have
to.
Well,
it has to be with the exact minimum essential benefits. There's 10 minimum essential plans or benefits that have to be built in there. Also on the individual plan, you have to have pediatric coverage in the plan for vision, which health plans don't have today.
Wow.
And you also have to have pediatric dental available to age 19. And if it's not embedded in the plan, it has to be offered as to the side of the plan. These are the types of things that are now required. Even if you don't want it, it's there.
My goodness. All right. Here's another call. Good morning. You're on with Vic. What's your question?
Yes, good morning. I have a question here. Well, not a question, but I had been hearing that many employers were going to be cutting the hours of the employees because of this Obamacare, and I kept thinking, well, that's not possible, but it is, because my godson had been working full-time, and now all the employees where he works have had their hours cut.
Mm-hmm.
Now, is this going to happen to everybody?
Well, it's not going to happen to everybody, but what if employers have not been offering coverage prior to this law going into effect, they're going to take a serious look at reducing hours. We consult with some very large restaurant chains, as an example, and they now have to monitor part-time employment, whereas before, if they needed people for extra hours, they would just call them in because they were busy. Now they have to monitor, and they have to keep them below 29 hours a week. Otherwise, they have to provide benefits for them. And in one case, one of our groups, it would cost them an extra $1 million.
Yeah.
So, yeah, it will be monitored. There will be some employers that will cut back. We're going to have a lot more part-time employees than we've ever had before.
Yeah.
Yes,
and I think
that's
Olive
happening.
Garden, the head of Olive Garden, initially when this all started, got into a little riff or tiff between himself and the White House. You remember that?
Oh, yeah. Yeah.
So they were
Darden, they own Red Lobster and some other companies, restaurant chains, and they're now going to have to they have to monitor it.
Right.
And there's also rules for common ownership. So if I own a company across the street, even though it's a different corporate tax ID number, I can't send my employee to work over there because of common ownership.
Unbelievable. We're talking with Vic Gunderson, a lot of ground to cover here. We're going to put some graphics up on the screen after the break. We're going to come back, 436 MeTV option 11. Remember, turn down the sound and don't wade through the message.
When you like Ventura TV Appliance on Facebook, it's nice. But when you love the Samsung big screen we deliver, it's even better. Our website is cool, and it's a good place to start. But you really should touch the merchandise before you buy. Time for that upgrade to an HD 3D web-enabled Samsung TV. Get the best selection, price, and service in town without waiting. Come in to Ventura TV Appliance and touch the merchandise today.
Back here with Ask an Expert Day, and the expert is Vic Gunderson. He is from Dermanuel Insurance Company talking about the Affordable Care Act. We'll put up the disclaimer just real quick here. I don't want to spend too much time on this because I want to talk about the Affordable Care Act, but this is basically to say that our guest today came here of his own free will, and we asked him to come. He's not getting paid. We're not paying him. And we appreciate him being here to explain what's going on with the health care coverage now. That's going to go into effect here in the next 6 to 8 to 9 months on the Obamacare side. Anyway, Vic Gunderson is here. And Vic, so like we were just talking in the break, if you don't have kids, this pediatric stuff that's embedded in there now, you're going to get it and have to pay for it whether you have kids or not.
Yeah. It's
Why?
embedded in the plan. Well, that's
the law.
That's the law. That's what the carriers had to do.
Yeah.
The carriers had to have that. So if now if you're now it's embedded in the dependent side. It's not embedded in the. Maybe I can clarify that. If
Right.
I'm an individual buying an individual plan, that's one thing. If I'm buying a family plan, it's embedded in there whether you want it or not.
But I'm buying an individual plan, and let's say I don't have kids, I still have to pay for it.
No.
Oh, I don't.
I'll clarify that.
Okay.
I made a mistake on that. But
Okay.
yeah, it is if you're in a family plan, it is embedded in there whether you need it or not.
But if you're an individual, single, don't have kids,
No.
you don't have to pay
But
for
you
it.
still have to have the minimum essential, and also you have to play within the rules as far as the maximum deductibles and max out of pockets.
Okay, put up some full screens. We'll run these in order here. We'll put them up, put the first one up. In California, let's see, this is for individual plans. Okay, Aetna, Cigna, United Healthcare will no longer do business for individual health plans in the state of California. That means that more than 500,000 individuals will have their policies canceled by January the 1st, maybe a little later now. Explain why.
Well, and it's just not these, because Kaiser's canceling a number of them. I think 160,000 of them, as well as Blue Shield and Anthem, because those plans don't meet the requirements.
Again, they don't meet the requirements.
So they're canceled. Now, because there's guarantee issue, if you decide, as an example with Kaiser, if your plan, you get a cancellation, they will move you to another one, but you may have sticker shock, and that's what a lot of them are seeing now, sticker shock.
All right, we'll pick up on that after the call. Good morning, you're on with Vic. What's your question, quickly, please?
Yes, question regarding health care. Senior citizens that have Medicare and other insurance, will that affect them with the policy?
Medicare is not affected other than the Advantage plan. The Advantage is an HMO type Medicare plan. Some of those will be changing because there's going to be upwards to $700 billion worth of cuts for those plans to help offset the overall Affordable Care Act. And so what'll happen with some of them, they'll either no longer sell them and you'll go into a supplemental plan, or you'll have higher co-pays.
Yeah. Let's go back to that full screen graphic, that one that we had up before, because I want to expand on this a little bit. That date's going to change. It won't be January 1st now, right?
No, they're going to cancel by then, because January 1st, the new plans have to go into effect.
Okay, but so you have to be to March to sign up for the new one.
For a new enrollee.
A new enrollee.
Okay. A new enrollee.
All right, another
so
call.
They've got to swap out plans, is basically.
Another call here. Good morning, you're on with Vic. What's your question, quickly?
Hi. Excuse me. I was noticing where they said in the restaurant business, employees will have their hours cut to meet the insurance. I worked in the restaurants for 15 years, and this was from back in the 70s through the 90s. At that time, it was that was going on then. Employees would be cut an hour or two below what they could get benefits. They're not able to get benefits anyway. So as far as I see it, Obamacare is a plus for them if they're going to be able to get insurance benefits. There are so many people that have no benefits. They have to go to the county. They have to go to MISP. You get put on blood pressure medication in August. You're not seen until January to see how this medication is working. The system that we've got is not working right now.
Okay.
I don't disagree that we didn't have problems with that, but the prior to Affordable Care Act, if an employer had if their employer's policy was to provide benefits after X amount of hours, then they would cut back if they did it. As an example, an employer could say, look, I'm going to give an employee benefits at 35 hours or more. Then they would still have to monitor because they would be eligible. But now they have to cut it back to 29 hours or they will have to give benefits. Yes, if you're sick and disabled, it's no question, it's a better deal.
Another call, Vic. You're on with Vic Gunderson. Your question, please.
I'm on VA disability. Will there be any effects for me?
No. VA is exempt if you're on their health plan, just like TRICARE is exempt if you're on for military people on that.
Okay. Before we go to break, I want to put up that graphic one more time, that one full screen that we had up there, that first one, and I want to expand on that just a little bit before we go to break here. That's the one. Now, I want to explain this just a little bit. Nationally, they say now that up to 80% of 14 million Americans who are on the individual plans will get cancellation notices. They'll have to requalify for individual health care insurance. They're going to suffer some sticker shock because in some cases they may double their premiums because of the minimum requirements in Obamacare. In California alone, the graphic shows that up to 500 individuals 500,000, I should say,
Yes.
will be affected, right?
Yes.
And it's because of the same thing that
Yes.
doesn't meet the minimum. And so why is Aetna, Cigna, and United Healthcare getting out in California? Do you know?
Well,
do we know why?
They didn't have a big enough market share, and the problem initially with all of this, and the concern is in the first couple of years, if they don't get enough young, healthy people in this, these premiums will implode. Because all you're getting is a sicker, older people in this program.
Meaning the program won't have enough money to sustain itself?
Well, no, the premiums will double and triple than what they are right now.
You're kidding.
No, because you've got to have the whole concept of insurance is spreading the risk. And the younger people help with spreading the risk, the 26 to 30, 35-year-olds, because they're healthier.
And low risk.
And low risk, and you need those premium dollars to help offset the higher risk individuals.
Another call. Good morning. You're on with Vic Gunderson. Your question, please.
Yeah, no, I'd just like to say I'm getting more information from him than I did off the website, and I'd just like to know what he's charging and what it costs the government.
That's good.
Well, I appreciate it.
I appreciate the comment, but yeah, they're covered. Actually, if you went directly to the California site, it's coveredca.com rather than going through the federal to get to the state. You might get there a little quicker, but part of the problem with California was on top of this. The problem is California also has to talk to the central hub, which is run by the feds, because they have to verify through Homeland Security who you are, and Social Security. They have to verify your Social Security, and they have to verify your income through the IRS. So all these entities have to talk to each other in the process of your application. That's where your problem is.
We are under the microscope, Vic. There's no question about it. I mean, we can't hide, not even under a rock anymore.
No.
Anyway, we're talking to Vic Gunderson. He's from Dermanuel Insurance Company, been around for about 36 years, talking about Obamacare. Back with your phone calls in just a moment.
Remember me?
After practicing law, Raymond Berg fought crime.
You have the right to an attorney.
As a hard-boiled detective on wheels.
Ain't it the truth?
His name is Ironside.
Perhaps you wouldn't mind saying it again.
His name is Ironside.
All right, now you've said it.
Nothing slows him down.
I want to see this one firsthand.
Now on MeTV Fresno, Xfinity 187.
What are we waiting for?
We've got 6 minutes left. Let's put up the graphics. The next one, because we got to go through these before the end of the show, and Vic can comment on them. California covered. Health insurance is run by the state, of course. Agents must have 12 hours of training and testing before they can sell insurance. True or false?
Well, it's not run by the state. Insurance company run by the state. It's It's where you can purchase your insurance, because the Blue Crosses, Kaisers, and Blue Shields will still be there. It's just marketing. It's a place to purchase it, but you do have to go there if you want or might be entitled to Medicaid or Medi-Cal, or if you might be eligible for tax credits.
Okay, next one. Let's see. Every state is part of the national federal plan. Is that true or not true?
Not true.
Okay, 6 states are in partnership with the federal government.
Yeah,
right?
on the other, there's actually 38 states, of which of the 38 there are 6 in partnership.
Okay.
Right. And then the rest have their own, like California has their own. But know this, that if the covered California is not financially sustainable by January 1st, 2015, the feds will step in and take it over.
Really?
Yes, because it cannot be subsidized by the state of California or its taxpayers.
Learning something every minute here, by the minute on this show. Anyway, qualify for the government exchange. Individuals making less than $45,000 a year will qualify for the government dole. That's kind of a term. Family of 4, less than $94,000. A family 6 to 8, you have to be making less than $115,000 to qualify for a government subsidy. Now, I think, I looked on the internet that these figures are kind of accurate. They're for the most part.
They're close.
They're close, yeah.
Yeah, and
but what happens
now? They also expanded Medicaid, so Medicaid January 1st gets expanded to 138% of the federal poverty. So.
All right, what happens if somebody's making $45,000 a year, they qualify, or less than, and they qualify for this government subsidy, and then all of a sudden their boss gives them a raise about 6 months later up to $50,000? What happens now?
All right, here's the trick that a lot of people don't understand. When you sign up for this, you have to estimate your income. Okay. Now, if you underestimate it, and then you go to file your taxes the following year, and it's been underestimated, that you will owe money from your tax return back to the government based on retroactive for that. And also, if you move up into a different category, you could end up paying a lot higher premium because the subsidy reduces.
Amazing.
So you get a double hit.
So it's like it's almost like a tax.
So at the end of the year, if the employer's thinking of giving you a bonus, I've done a couple of calculations, and I've seen where the bonus gets completely wiped out.
So put a delay on the bonus,
yes.
huh?
Put a delay on it and plan on it the next year.
I never heard of that. Your boss wants to give you a bonus, and you say, no, I'm sorry, I'm going to take a delay on that. Your boss might fall out of his seat.
Give it to me January 1st so I can plan on it.
Give it to Vic. He'll put it in some kind of a CD for you later on. Anyway, just kidding, folks. Yes. I'm just kidding. When is someone eligible for tax credits? How do tax credits work in healthcare?
Well, basically, when you go online and when you go online to apply and they verify your income, then based on the verification of your income, you get a choice on your tax credits. In other words, the IRS says, hey, you're entitled to X amount of dollars in tax credits. You can either take it all now, of which they would send it to the carrier, and the carrier balance bills you for the difference, or you could take part of it, or you can say, no, I'm not going to take any of it. I'll wait till the end of next year, or I file my taxes and I'll take it then. So you make your decision then how you want.
So you have three different choices,
yes.
Basically.
Yes.
Okay. Yeah. What about deductibles? Are deductibles going to be higher under the Affordable Care Act in most cases with either individual? I know that affects the individual.
It depends on which plan. Now, if you had a $10,000 deductible, you won't be able to have that. If you had a $2,000 deductible currently right now, or if you had like a $250 deductible, you're not going to be able to keep the $250 without a huge premium because the cost is prohibitive.
So what's the deductibles going to be? Are they going to be higher?
They'll be higher. Max out of pocket on all your plans will be $6,350. That counts the deductibles, that counts your coinsurance. So you're not only getting sticker shock, in a lot of cases you're seeing more money out of your pocket in the health plans.
So minimum deductible or maximum deductible will be $6,300?
No, that's the maximum out of pocket.
That
includes your deductibles, co-insurances.
But deductibles could be as high as what?
Well, your bronze plans, some of the ones I'm looking at, $5,000 deductibles on the bronze, and those are your least expensive.
Wow, that's amazing. So, okay, let's go to the website. We're going to show some of the website stuff that's been. We all know what's been going on. We saw the Saturday Night Live spoof. This doesn't apply to California, though, right? Because we're not.
Well, California has their own. You can go direct, or you can get through the government site.
Okay, but why are they having problems with this website? What's the deal?
It's not so much this. The only problem they really had with this website was the doctors list. But
the national website why?
They just didn't build it. I mean, they've got an antiquated system that everybody's trying to talk to, and they didn't.
Too many cars on the freeway.
Too many cars on the freeway, and they didn't take the time to test it. I mean, the carriers didn't even have to turn in their plans for approval until I think around July of this year. And you just don't fire up an internet and have all these people start talking to each other and testing it. They should have had at least a year run on this to get all the bugs out of it.
Anything else that our viewers should know? We have about a minute left or so, something like that. 30 seconds. In 30 seconds, anything else you want to tell our viewers about this to beware of?
Well, I think the biggest issue is in estimating if you're entitled to tax credits is watch your estimation of your income, because know that it's going to come back. If you decide not to take it, there will be penalties when you file your tax return. The first year, it's a minimum $95 up to 1% of your income. By the third year, it'll be up to 2.5% of your income. But the max penalty will be equivalent to a bronze plan.
And we have more calls coming in. We can't take them. We're out of time. We need an hour, 2 hours today.
It usually takes me 2 hours.
Vic Gunderson, wait, can you come back?
Sure.
Like maybe after the first year?
Sure.
All right. Vic Gunderson, Dermanuel Insurance Company. He's a great guy. And our friend Mike Dermanuel, say hi to him. Insurance company been around for 36 years. We're back tomorrow with another edition of Connect with Me here on MeTV Fresno. Have a great day.
This is Adam 12.
1 Adam 12, roger.
Now on MeTV Fresno, Xfinity 187.